Practice in Ewing. He's a founding member and member of the Healthcare Committee of the KCCP. His undergraduate degree is from the University of Pennsylvania, and his dental degree is from the University of Medicine and Dentistry of New Jersey. And he'll be speaking today about gingivitis.
Thank you, Leslie. I thought my introduction would be as long as at least of Dr. E, Peter E. I thought that at least Leslie was going to mention that I'm a good husband and so on and so forth. If anyone didn't know, she's my wife. I thought there would be some favoritism, but I guess not. As a dentist, actually, dentists don't really get to talk in front of so many people. As it says, we have to insist that we are friends. And it could be just like a person who is doing karaoke and they get the microphone for the first time. You'll never let it go. So I may be standing here, go on and on and on. So just tell me to shut up when if I need to go. Well, actually, in dentistry, there has been a very exciting new development because of the modern technology. We start doing a lot of implants, bleaching, and a cosmetic dentistry, and we start using CT scans and also the computer imaging systems, so we can produce crowns and bridges and start making implant abutments. And now there's some other scientists are working on instead of taking impressions on patients to make appliances, we start using 3D imaging systems. And one day I'm sure it'll be perfected, and I'm sure we'll be using it very soon. It's just unfortunate that Dr. Anna Lee, I have no relation with her, but she's supposed to speak about implant. And I would imagine, I understand she'll be doing that next time around. I hope that all of you here will attend it, and it's a really, really exciting subject. And I'm sure you will learn a lot. Now, when it comes to my subject, I wasn't quite sure what I was going to talk about today when I was asked to speak. And because I've been practicing more than 25 years, and after a while, everything gets somewhat monotonous, and you just do things. Not that doesn't mean that things are boring or not challenging enough, or that I do not enjoy what I do. I really enjoy, making the people smile and all that, and that's quite nice. But I had a pleasure of meeting Dr. An for the first time at the last KCCP healthcare meeting, and he is I see him as a research scientist, and I think that research scientist has a very different idea about things. They usually start from the bottom and build things up. As a clinician I just do what I do, but they think differently. And we talked for a while, and he convinced me that I really should talk about gingivitis. Because, whoa, okay. All right. This is written in Korean. It talks about obok, which is I'm sure all the Koreans know what it means. That talks about 5 different fortunes that one could have. And in this respect, actually, when I was growing up, and everyone was telling me that teeth are one of the 5 oboks, and I had no idea what the rest 4 are. And so I called my mom, and what are those? And she helped me out, and then she found out what they are. Actually, this obok actually originated from Confucius teaching. And those 4, the 5 of them consist of longevity, wealth, health, ethics, and very comfortable ending of life. And that's what the 5 things stands for. And then it gets translated into layman's interpretation, which most of Koreans know of. They are good teeth, having many children, and love between spouses, and being able to entertain guests, and having a good burial spot. And those are the 5 fortunes that we should have. And I guess a good teeth translate into being able to eat a lot of good food by having teeth. I guess that means we are having good health. And obviously, our Korean ancestors knew the secret of having very, very healthy life. And so we do agree, as the Koreans, the ancestors tell us how important the teeth are. Yeah, okay. Now, then let's talk about the gum problems, the gum disease. And so what is gum disease? What happens is when the tissue around the teeth are inflamed, and that is called the gingivitis. And when the gingivitis is not taken care of, and it's totally ignored for a long period of time, then it starts destroying the supporting structure, such as the periodontal ligaments. Those are the ligaments that actually holds the tooth to the bone, and also destroys the bone. And then we call that a periodontitis. Then what causes the bleeding gums? And there were actually, it also divides into 2 categories. And one could be from systemic problems, such as taking blood thinners, or uncontrolled being a diabetic, or a blood disorder, scurvy, leukemia, and so on and so forth. Also, it could be coming from either lack of oral hygiene or not being able to keep up with oral hygiene. And in other words, either a person do not brush their teeth, or they do brush their teeth once in a while, or even if they want to brush their teeth, they're not doing it properly, or they just cannot brush because there are certain defects in the teeth.